For each traveler who has transited from or through one of the affected countries, our officers, Customs and Border Protection officers, will provide the CDC with a CDC fact sheet outlining the signs and symptoms of Ebola. And the passenger is then going to be directed to a private area where the individual completes a CDC questionnaire and contact information. Customs and Border Protection has authorized and coordinated medical staff that will take the traveler's temperature and assess if it is within a normal range. Right now, United States Coast Guard corpsmen will be providing that, but eventually we are contracting actually very quickly with professional medical staff to do that. Well, if the traveler has a fever or other symptoms or has been exposed to Ebola, Customs and Border Protection will then refer that traveler to the Centers for Disease Control for a public health assessment. And from there, the CDC determines whether the traveler can continue on or is taken to a hospital for further evaluation or referred to a local health department for further monitoring.
We can't get the risk to zero. That will not be the case, but this additional layer should add a measure of security and assurance to the American public. This entry screening procedure, for example, would not necessarily have caught the patient in Dallas as indicated, and no port of exit or port of entry or airline response procedure will supplant the need for state and local public health departments, clinics, hospitals, to be prepared to detect a case might it occur and to rapidly identify, respond, isolate, and prevent transmission.